Hello, my name is Giovanna Zandomenici Campos, and this is my case 33 for SPCE 683803. So as we discussed in the presentation 1 and 2, this client is 8 years old. He was diagnosed with autism spectrum disorder and hyperactivity disorder. And the behavior that we decided in the last presentation that we're gonna be covering, it's task refusal behavior. This presentation is dedicated to talk about validity and integrity and how we're gonna measure it. I have never measured this both of these things, so it will be my first experience doing it. After participating in different classes, reading articles, researches, speaking with my supervisor, I have developed these measurements, this way of measuring validity and integrity, and this include competency assessment based on the RBT task list second edition, the use of behavioral skill training, in which we'll be covering token economy. So token economy will be the skill that is going to be taught to the staff in this case, and which is also the intervention that we decided in the case study number 2 to use with this client. And inter-observer agreement also is going to be another tool that we're going to be using. So validity refers to the accuracy and appropriateness of the intervention and measurement procedures, ensures that the intervention measures what is intended to measure and that the results are meaningful and applicable to the target behavior and context. The integrity refers to the consistency and accuracy with which staff implement behavioral interventions and follow professional standards and the prescribed protocol. So the RBT task list is an invaluable tool for analyzing, correcting, and improving the procedures implemented by the staff. To evaluate the validity and integrity of these procedures, the following tasks will be taken into consideration. Task A2, implement continuous measurement procedures. A6, describe behavior and environment in observable and measurable terms. C3, use contingency of reinforcement. C12, implement token economy procedures, which is going to be the intervention that we're going to be using and teaching. D3, implement interventions based on modification of antecedents, such as motivating operations and discriminative stimuli. And F5, maintain client dignity, which is crucial for measuring the integrity. This is our behavior skill training, which is very used in behavior analysis, not only to teach, but also to measure the validity and integrity. So using BST, we first start with the instruction, which consists of explaining the token economy, in this case, and its purpose. We'll also use modeling as the second step, and demonstrate to the staff how to deliver tokens for task engagement and how to manage the exchange process. We can use descriptions such as, watch as I give a token when the client completes their worksheet. Notice how I explain what they did to earn it and how they can trade it for playtime. So the third step consists of rehearsal, in which the objective is to allow the staff to practice the token economy system. In this case, I will have the staff role play different scenarios where they deliver tokens for the task engagement. I can also provide different examples and situations where the system should be used. During this role play, another staff or even me can pretend to be the client. The fourth step is feedback, which is very important. Once the staff completes the performance, I will deliver feedback. An example of a constructive feedback could be saying, you did a great job giving the token right after the task was completed, but next time, make sure to explain why the client earned the token clearly. The fifth step consists of monitoring, which I will measure the frequency of task behavior before and after implementing the token economy. I can also measure the token distribution to know the number of tokens that the staff is given each session. The final and last step is evaluation. I need to know if this behavior skill training is being effective so far for my staff. I will compare pre and post implementation data to measure effectiveness. Another excellent method for measuring the effectiveness of the staff implementation of intervention is using inter-observer agreement, or IOA. The IOA is essential for ensuring the reliability of data collected on target behaviors. It calculates the percentage of intervals or trials where the observer counts exactly match each other. In this case, since the target behavior is off task, we will be using exact agreement IOA. And this is how it works. Both observers independently count the number of occurrences of the target behavior in each trial. Then we compare the counts for each trial between the two observers. Finally, we identify the number of trials where the counts exactly match and divide it by the total number of trials, multiplying it by 100, which gives us the exact percentage of agreement. So most of the information were collected from the BACB website. And as I mentioned before, I have never measured validity and integrity of staff, but that's how I plan on measuring in the future once I become a BCBA, in order to provide an excellent service to my clients. I hope you enjoyed watching this presentation. Bye.